In this video, we will be discussing actinomycosis. It is a bacterial disease which is caused by the bacteria Actinomyces bovis, which is gram-positive rod. The characteristic feature of these rods are they have branching natures. So these branching structures looks like the fungus myces. So it's the name given that actinomyces, which cause lumpy jaw. This should be differentiated from actinobacillosis, which is also an bacterial disease that involves soft tissues of the body, such as tongue. So the name given that wooden tongue in actinobacillosis. And in case of actinomycosis, these organisms are involves mainly the hard tissues of the body, such as mandible, maxilla, and other bones of the head. So actinomycosis is a hard tissue disease, whereas actinobacillosis is a soft tissue disease. With this information, let us look into the other aspects of the disease. Etiological agent Actinomyces bovis, which is gram-positive anaerobic, non-acid-fast rods, mainly which are filamentous or branching. Because of these characteristics of the gram-positive organisms, the name given as myces, actinomyces. And it is not an acute disease. It is a progressive chronic disease characterized by granulomatous and suppurative lesions that mainly affecting the mandible, sometimes maxillae and other bony tissues of the head. And there will be rarefying osteomyelitis of the mandible will be there. The bone become very fragile and there will be inflammation of the bony tissues will be noticed. And when it comes to host range, cattle are mainly susceptible and less frequently it is seen in other animals. And it is transmitted through any aberrations, injuries or wound created on the mucous membrane or any on the skin. Through that aberrations, the organisms get entered into the body, thereby start initiating the disease process. Sometime during the eruption of the dental alveoli, at the time also the organisms, there will be chance of getting entry into the body. And the main point is that these organisms are normally present in the alimentary canal, and where these organisms may invade the subepithelial tissues through injury by surface objects. Generally affect the cattle between 2 to 5 years. They are sporadic, rare animal to animal transmission is noticed. Now let us look at the pathogenesis. So during the feeding of low quality, dry, stalky feed, grass seeds and coarse hay and scrub can cause mouth aberrations. So that allow the entry of infection into the body. After the getting entry into the body, the organisms reach the bony structures where it results in facial distortion, loosening of teeth, so making difficult for chewing, and dyspnea from the swelling into the nasal cavity. Any part of the head can be affected. However, the alveoli around the roots of the cheek teeth are frequently involved. The primary lesions appears as slow growing firm mass will be there, and that is attached to or the into the part of the mandible. There will be some small organisms surrounded by a mass, so we call it as the lump. So it is called as lumpy jaw. And in the chronic condition, there will be suppurations, and sometimes those will burst, leading to the formation of ulcers. And with or without fistulous tracts, fistulous tracts are nothing but the opened inflammatory tracts in the bones will get formed. Through those fistulous tract, there will be drainage of purulent exudus may occur. Clinical signs and symptoms like a hard, painless, circumscribed protuberance, usually at the level of central molar teeth of the mandible or maxilla. The disease starts from the central molar teeth of the mandible. And invasion damages the bony tissues, followed by development of sinus tracts. Sinus tracts are nothing but these are also the inflammatory tracts, but they are blind there will be no opening through and through. There will be no opening of the tract, but there will be only opening at the one point, other point is closed, so we call it as closed inflammatory tract involving the mandible, maxilla. So formation of the difficult in the mastication, ultimately leading to impairment in the digestion, resulting in the loss of general health. Abscess may extend and may produce sinuses to the skin surface, where from the purulent discharges are drained. Initially, we discussed this. And there may be loose teeth or missing teeth and foul breath, and hypersalivation, dyspnea can also be noticed. And the main thing is that the adjacent lymph nodes are not affected, and hence the disease does not spread through lymphatic channels. This is the differential point from the actinobacillosis, where the involvement of lymphatic vessels and channels are seen. In this picture, you can see the lumpy jaw in cow, where classic mandibular lesions of suppurative pus forming and proliferative osteomyelitis, more precisely rarefying osteomyelitis caused by actinomyces bovis. Now, look at how to diagnose this disease. Uh, it can be diagnosed very easily based on clinical signs and through demonstration of organisms as gram-positive rods in yellowish pus. The pus become yellow because of the presence of sulfur granules from the aspirated from the purulent material. The purulent pus material contains the sulfur granules. Within these sulfur granules, there will be organisms. So those are gram-positive rod. And bacteriological culture and histopathologies are confirmatory. And the organisms appear as long filament and branching pattern. And to treat this actinomycosis, one can use sodium iodide or potassium iodide. It is the drug of choice. 70 mg per kg body weight of 10 to 20% solution given IV. Is given once and repeated several times at 7 to 10 days intervals. And antimicrobials can be used such as penicillins and oxytetracyclines. And to control the disease, avoid coarse, steamy feed or any factors which causing aberrations wound on the mucosa or skin, and isolation of the infected animals and their treatment. Removal of contaminated material and disposal of animals with discharging foci. This is about the disease actinomycosis. In next video, we will try to come up with actinobacillosis, and in that disease only we will differentiate again between the actinomycosis and actinobacillosis, so that we can appreciate the content clearly and very precisely, and able to reproduce in the examination and get good marks and understanding. This is about today's. Thank you and bye.